Afternoon, everyone. Good afternoon. Thank you all for joining us for what should be an amazing conversation today. We are joined by some extraordinary healthcare professionals across different HBCUs across the country, and we are excited for you to be joining us today. We have participants that are jumping on the line, so we want to respect your time and definitely allow all of our participants to share the different insights that we have. As you can imagine, there are different challenges and different responsibilities that we all have as healthcare professionals. And we thought it was just very important to create this platform or to create this opportunity for some of our healthcare professionals across different HBCUs to just share some of their insights and some of the experiences and challenges that they are having across their different campuses. So we thank you all for joining us today for this much needed conversation around the impact of COVID-19 on HBCUs, and in particular, HBCU student health services. I don't think it's any secret that over the past several months, we all have been faced with unprecedented challenges, adapting to a new way of life that has impacted everything from the way we interact, shop, engage with families and friends, and largely how we view our lives. Our homes have become offices, and virtual meetings have raised questions about how important was that in-person meeting actually? You know, all those meetings that you have in person that now we're doing virtually, how important are those? Kind of make you ask questions, but we'll talk about that later. Every industry, as we know it, has had to pivot and address tough questions about access and really what to do next. This is extremely evident in higher education, where our campuses are empty, students are largely working remote, and unfortunately, the class of 2020 will likely not have a commencement ceremony. But most importantly, student health services has moved front and center to address the growing wellness needs of our campus population. And HBCUs now more than ever are being tasked with stepping forward to support the needs of students of color and provide some capacity of services to support the well-being of our students, both in person and virtually. That's why conversations like this are so important, because they provide a platform for HBCU health professionals to not only exchange knowledge around important topics, but also share information and best practices that are relevant and to the importance to the students that we serve. And we are fortunate today to be joined by an extraordinary group of HBCU student health professionals from all over the country to provide their expertise, share their experiences, and discuss what their campus health services are doing. Today on our call, we are fortunate to have Dr. Cynthia Burwell, who is from Norfolk State University, who is a professor and a director of the Norfolk State Center of Excellence in Minority Health Disparities. We're also joined by Dr. Yolnada Nicholson from North Carolina A&T University, who is a family nurse practitioner and also the director of clinical education and wellness promotion. Dr. Rita Wutoh, who is from Bowie State University, who is the director of the Henry Wise Wellness Center. Carlquista, who is the interim director of the Student Health and Counseling Services at Alabama A&M University. We're also joined by Dr. Padonda Webb, who is a family nurse practitioner and also the assistant director of operations and compliance at North Carolina A&T University. And lastly, we're joined by Dr. Maury Ross Alexander, who is the assistant vice chancellor of health and wellness. And I'm your moderator, Dr. Micah Griffin, who is the director of health programs at the City University of New York. So thank you all again, both to our panelists and to our attendees for joining us. So we're gonna just jump right in that conversation, and just to kind of give us a start and just to give us an overview, our perspective about what the different colleges are facing. We want to kind of hear from each one of our panelists and just kind of, if you could tell us a little bit about what your campus is doing, how your campus responded, and how has this pandemic impacted your campus in particular, and what steps is your health center doing to respond? Dr. Wutoh, do you mind kind of starting us off with kind of what Bowie State has done, how your campus has responded, and maybe some creative ways that your health center is responding to meet some of those students' needs right now?
Sure, I'd be glad to. Okay, good afternoon. So actually immediately we started with activating the emergency response team, which is, we have representatives from all across the campus represented, and we've been meeting twice a week since COVID became prominent in the Maryland area. Actually, right after, I guess it was before spring break happened, a couple of days before, we decided to go ahead and cancel cancel classes for a couple of days, give the faculty a chance to get to transition to online courses. So that was the big thing, is transitioning from face-to-face classes to online, gave faculty a chance to prepare and get situated. And then we basically had a week of spring break in order for classes to transition. And the timing seems to have been really perfect, not having students return after spring break, because that was the time actually that a lot of people who, at least affiliated with Bowie State, became ill with COVID-19. So I'm glad that we did not return, because then there would have been more transmission. After spring break, we then transitioned into telework, particularly for non-essential employees. And then we started transitioning into shift work for essential employees. At the Wellness Center, we started rotating who would come in. We wouldn't all come in at the same time. That took a little bit of time, maybe a couple of weeks, and then we're now only coming in 3 days a week, 1 day per person. We also have a food pantry that we still are staffing 3 days a week from 11 to 1 to try and give students and staff support for food items. And that actually is still being well utilized, not as much for students, but at least our community is using it on a daily basis. And then as far as our student health, we are using telephone right now to take any appointments, make phone calls, or do prescription refills. We do not have the capability right now as far as doing the video conferencing. We use point and click for electronic health record. And we are in the process of getting various prerequisite software in order to get the full video conferencing. Using the Zoom is what point and click would be using. And then last, I guess probably a couple last things. I've been responsible with tracking the COVID cases or any reports from third parties, any students who have symptoms, and finding out, are they in fact, have they been confirmed? Have they been tested? Refer them to testing sites, and then following them out on a daily basis to see how they're progressing. And then lastly, we've been doing a wellness challenge that we had already planned before the spring break. And that is, we did it for 30 days, providing resources to, follow your nutrition, exercise, and mental well-being. And I'll close with that.
Okay, thank you for that. Ms. Slade, can you tell us a little bit about what Alabama A&M University has done to respond, and maybe some steps that you all are taking to address this?
Yes, thank you for having me. So Alabama A&M University has really embraced the COVID-19 shelter-in-place order. Even though the changes were very abrupt, it seems like there was a seamless transition on our campus. We were already making preparations prior to, with our faculty and staff, kind of understanding how to telework and making sure technology and everything was working appropriately, and also to ensure that our students knew how to access online courses, because for some of them that is their very first time doing the online learning. And so we wanted to make sure prior to shutting down campus that our students as well as our faculty were able to log in and access those services. Now, from the university perspective, what they have also done is weekly we have a COVID-19 update meeting, and it consists of various departments on campus, and everybody can get the updates in one place, and the information is being transmitted through our public relations and marketing personnel. And so that is a really good thing that we are doing. And it also helps with our communication, keeping our communication open and in real time for the most part. From the student health aspect, it has been an amazing experience. Some people may look at it as a negative. However, we have definitely embraced this change. It has really stretched us to be more creative in our service offerings. And so what we do is we have weekly meetings, updates on staff to see how they're doing. One, I want to check in on their mental health to make sure they are maintaining through this time. And also just to see if they are in need of anything, because their offices have turned, their home has turned into their office. Some of the other things that we have been doing, again, a lot of our staff is working on virtual programming. We are working on cognitive reframing flyers that have been going out social media, via our social media platforms. We're also happy to have just completed our first virtual sexual assault awareness month week of events, and it was really great. It went off without a hitch. Our students gave really good feedback, and we were also able to identify students that needed some additional support through counseling. But we are providing telehealth services on our medical side as well as our counseling side. We are using a platform called DoxyMe, which is a free platform for telehealth. And we have been gracious enough that licensing board have loosened the restrictions to allow us to provide those counseling services to our students that have gone back home across state lines. The same thing for our medical services. We are providing limited, well, not limited, but modified services. We still have face-to-face on an as-needed basis, and our nurse practitioners and our medical doctors are doing a really good job of taking care of those students. But again, most of the staff now, they have more time to focus on our programming, and so we are doing pre-recorded workshops on stress management, STD and STI prevention, diabetes. So again, when all of this is over and we return to our new normal, hopefully we can continue to use these platforms that we've had to utilize and just, again, continue our service offerings at an expanded level. So we're excited about it.
All right, thank you for that. And real quick, I just want to encourage our attendees. This is an interactive and engagement opportunity. So please feel free if you're currently working in student health, whether it's at a HBCU or a PW or any institution, and you want to share some of the tasks or some of the steps that your campus is taking, feel free to use that chat box that's located on the side, because that'll definitely give us some feedback to our panelists as well as the other attendees on things that they're doing as well. Next, we want to hear from Dr. Ross Alexander. If you can tell us a little bit about what North Carolina Central University has done and maybe some steps that you all are taking right now to respond to this pandemic.
So similar to what, the other presenters have said, we've shifted, right? So we moved to this format where we're providing telehealth, telebehavioral health. We do have students on campus still, so we're having to do contact tracing when they test positive or if they've been in contact with somebody that's positive. So that really shifted our housing. So we had to change up, a quarantine hall, an isolation hall. We've been successful in managing those things, but that has definitely been challenging and unique to this situation. My student health unit has been amazing at, being boots on the ground. So they are involved in policy. They're involved in the committees that are formed around COVID and how we're going to bring our students back in the fall. We are being charged with that at this point, so we're coming up with plans around that. So like I said, we have moved to a telehealth format. We do have in-person visits, but those are after a health screening has been conducted, and we moved to an urgent care format for our health center, so we're only seeing 6 students at this point. Our building is set up where we can't differentiate between a well visit and a sick visit. So we're also looking for other places on campus to develop a well visit clinic so we can actually service our students, because the majority of our students use our student insurance plan, and it costs them more money to go outside of our system. So we're really trying to make sure that we give our students who rely on us for their healthcare access as well. So very similar to what the other presenters are saying, we've shifted to this online format. We're definitely at the forefront of policy and planning for our institution, and we're doing what we can to make this all work.
Okay, thank you. Dr. Webb or Dr. Nicholson, if you all wanted to just share a little bit with what North Carolina A&T is doing in response to COVID-19 and maybe some some challenges you faced or some different creative ways that you all are engaging students?
Yeah, similar to a lot of the universities that have already spoken prior to us, we've implemented a lot of those things. Initially, when this first started, we were having daily briefings. Those daily briefings went to twice a day pretty quickly. We've now scaled back to about once a week briefings. We are doing some telepsych with a psychiatric nurse practitioner and some telehealth. Our clinic is still open and operational. We see walk-ins as well as appointments. So the people that walk in, we quickly noticed that we needed to find a way to kind of filter through that so that we didn't expose, our staff. So what we did was we locked the front door, and we have a sign posted for students to call in so that we can do a pre-screening prior to them coming into the building. We also installed plexiglass.
I'm sorry, Dr. Webb, they saying they're having a hard time hearing you a little bit.
Can you hear me? Okay,
Yeah, I think it was
speaking too low. Is that better?
Yeah, that's better. Yeah.
Okay, all right. So we installed plexiglass just to protect the reception staff. So I think that that's been pretty effective and provided masks for people that, as they're coming in. Can you guys hear me pretty well?
Mm-hmm.
Okay.
Yeah, we can.
We are also taking temperatures to make sure that we kind of have a good idea of, what the person is presenting with. Recently, we implemented a policy where we are not only taking the temperature of the student, but our employees, as they come in, report to work. We are taking their temperature as well and doing their oxygen saturation to make sure that our employees are well. Daily cleaning, there has been a lot, I think, going on. And Dr. Nicholson, you can kind of speak to this as well if you feel like I've missed anything, but I think that COVID definitely has changed the health center. I think, it's been a challenge for sure, but some of the things that we have implemented, I think are very positive things, and I think we'll carry forward even after, this resolves itself, or at least decreases.
Okay. Thank you for that. We had a couple questions come in, but Dr. Nicholson, did you want to raise some of those questions now? I think they were related to some of the things our panelists just brought up.
Yes, so one of the first questions that were sent forth to us is, what sort of thermometers are we using?
And that can be open to anybody who was taking. I think Dr. Ross, you said you all were taking temperature, and I think Dr. Webb, you mentioned.
We're using the infrared thermometers, so it's a no contact thermometer.
Okay.
And we're using a standard oral with a disposable protective case over it. So that's what we're using.
Okay. I do see we have a few questions coming in, but I did want to give Dr. Burwell a chance to answer this question as well, just so we can hear about what Norfolk State is doing to respond to COVID-19, and maybe some exciting things or creative ways that you all engage in students, and then we'll jump back in and have our panelists answer those questions that you all sent in.
Okay, at Norfolk State University, I've been in touch with our Student Health Center. I'm a faculty member, but work closely with our Student Health Center. And they have been on the front lines from the beginning of this. They are part of the university emergency team. And from the beginning, they have worked to put together or to implement the guidelines that CDC put forth as far as COVID-19, as looking at how we can social distance, what protective gear we need, those sorts of things. Our staff at the health center right now is working with students via appointments, via phone, telephone, or video. They are, right now I would say the patient flow right now is low. So right now, they're not seeing any non-essential problems, but if student has a problem, they actually will see them via the telephone or video. I want to say that they work very closely with our residence halls in, you know, we do have some students that are on campus who may not have had a safe place to go to, or we have some international students who were not able to go home. So they've worked very closely with residence hall staff to make sure that they are in compliance with the CDC guidelines. And we've done some things as far as providing some webinars and things like that, but we'll get into more of that discussion when we talk about the mental health part.
Okay, thank you for that. We had a few more questions I think came in for you, Dr. Nicholson. We can probably answer some of those. I think that's all related to, I think, the topic we were just discussing.
Yeah, so some of the questions that have come up from folks that are in attendance include, one was, what type of PPE do you use? As well as how will you manage contact tracing in a busy campus? That was another big question that has been asked. So I'll start with, what type of PPE do you use? And so here at North Carolina A&T, and I think this has become universal, regardless of the symptoms, as long as they're not respiratory related symptoms, we always use a respiratory mask with each contact with each patient. In the past, that wasn't something we did before COVID-19. Anyone that has any respiratory symptoms, we do put on a N95 mask to complete that encounter with them. We do screen all the respiratory illnesses as well as each patient before they come into the building to make sure that we keep all of our staff protected. Each staff member has a mask as well as gloves to make sure that they're protected with that encounter, just in case for any reason a patient doesn't vocalize certain symptoms. So we still have another layer of protection as well as a thorough cleaning before and after each patient encounter.
Thank you. Did anybody else want to add anything as far as what type of PPE you all are using right now, the ones that are still on campus?
Sure, I will just add that at Bowie State University, we do have a small amount of gowns remaining, and we are using those. We've had to conduct a couple of gynecologic exams. So we're using the cap, face shield, gown, and then of course the N95 respirator. But the problem is that we only have probably less than 10 gowns left or remaining. So we just actually put in another order. We're hoping that our supplier, McKesson, will be able to deliver within a few weeks. So we're still on, everything's back ordered. So that's the challenge I think that we're all facing. As an alternative, thinking for the fall, we are now actually ordering scrubs, thinking that we can use scrubs and white coat as a substitute for the gowns if we can't get them in.
Okay, thank you for that. I think there was one more, because we do want to, these are some great questions, by the way. Thank you all for chiming in and, you know, adding that input. I think there was one more, I think, Dr. Nicholson, what was the biggest challenges in handling COVID cases?
Yes.
Did anybody want to respond to that? Like, what are some of the, I guess, the single biggest challenge you've had in responding, if there were any suspected cases on your campus or in the cities your school is in? What has been the biggest challenge in handling some of those suspected cases on campus? Dr. Webb?
I would say one of the biggest challenges that we had is trying not to create panic, and that's from administration and throughout, you know, our staff and even students. So if I would say the greatest, you know, our greatest challenge, that would be what I think it would be.
Okay.
Ours has been just the sheer coordination and logistics, you know, having to move to a hall for isolation, a hall for quarantining, you know, monitoring those students who had symptoms. Though all of those pieces, it's a daily activity. So our director of student health is charged with the contact tracing those folks down, getting them on the phone, and then finding out who they've been in contact with, as well as checking in with those in isolation twice a day, making sure they're taking their temperature, any other symptoms that they're having, and then getting dine-in services coordinated so they get their food on time and pick up their trash on time. So all of that coordination around having, sick students.
Did anybody else want to add anything before we move to the next question? I know we had several other questions come in, and we're going to try to do our best to answer all of them. But we just want to make sure we cover all of the topics today. I guess the last one too, before we move on, somebody asked, and I think this is related, for those that still have students on campus, are the schools providing PPE to students and staff that are still on campus? Like, do you provide things to students that are still in residence halls or any of your staff?
So at North Carolina A&T, we have PPE available for students that are coming in to be seen. We don't distribute it to the students that we still have left on campus. We have been providing some PPE for like the University Police Department and the residence halls, people that may come in direct contact. So we've provided some to those people, but we are limited. We have PPE on a recurrent, we're ordering it on a regular basis, but we have to be cognizant that at some point this could run short. And, we still have patients to make sure that we take care of. So it's a balance and somewhat of a challenge as well, just making sure that we are able to protect the other people on our campus, but ensure that we don't put ourselves in a bind as, frontline employees.
Okay. Thank you for that. And Dr. Wutoh, looks like you got a friend on here. They said they can provide you some disposable gowns. So make sure you link up with them, make that contact. Because if anybody else in here want to give away some free things, you got email addresses, we can make it happen. But no, this is the type of this is why these conversations are so important, because it allows us to have these conversations and connect. And like I said, see what other campuses are doing in this space. Dr. Webb, just make sure, because people are saying they still can't hear you. So just, I guess, turn the
mic a little bit closer.
Yeah, turn it a little bit.
Okay, I'll do that.
Yeah, they perfect, beautiful. There you go. But we did just want to respect time. Like I said, please keep those questions coming in. And Dr. Nicholson will definitely raise those as we have time in our conversation. But something that Dr. Burwell brought up that I think a lot of us don't consider when campuses close, when situations change, is the mental health and mental fitness of our students, and not just our students, but our faculty and staff that are on campuses as well. So that's why I thought it was very important for us to have this conversation just from a mental health standpoint. And Ms. Slay, if you want to jump in first and kind of just talk to us a little bit about maybe some of the counseling services that you all are still offering, whether it's telehealth, virtual, in person, and also what are some of the mental health challenges that some of your students are facing right now that you're hearing, and what are some ways that I guess us as student health professionals can address some of these mental health challenges that our students are facing right now?
So thank you. So some of the trends that we are seeing, even back before our students got sent home, once they found out they had to leave campus, and the fact that it was such an abrupt change, a lot of our students have had issues with adjusting to the change. Also, they are going back to the environment, some of them, the environments from which they left to escape from to come to school, and they're going back into the same toxic environment. And so that has really been a stressor for a lot of them. In addition to all of that, they still had to maintain doing their coursework online and adjusting to the new course delivery methods. And so our students are very stressed. We're seeing a lot of anxiety, a lot of depression. There have been trends in increased substance use, just simply for the simple fact of escaping their environment. And honestly, a lot of them have checked out in terms of their school engagement. They are not as engaged. I think it's just they're in survival mode. They're just doing what they can to make it through and hoping that this will end soon. So what we have done, again, continuing to allow our students to meet with us, so we're still accessible to our students. We have seen a lot of students want ongoing counseling sessions. Which is great because they have not checked out from their counseling session. So that's great. But we are providing, again, telehealth services, counseling, still on a wide range of issues, depression, stress, mainly stress and depression, anxiety, adjustment, and substance use right now, because that seems to be on the forefront of everybody's issues. But also we have a psychiatric nurse practitioner that does telehealth. And so for our more severe cases, she is able to meet with them and assess them for the possibilities of medication. And we have seen an increase in suicidal thoughts from our students. And so we have to be very vigilant during these times and to make sure that we are more accessible than ever with them. And for our students that do not want ongoing counseling sessions, but they just want on-demand services, again, we're doing pre-recorded sessions. We are doing things on social media. We are polling our students as we offer these pre-recorded programs. We're polling them and trying to engage them that way also. But what we have identified is that the more virtual programming that we're doing, we are connecting with newer students that have never been into counseling before. And they say, you know what, I really am stressed. I want someone to talk to, and we're able to link them up with a counselor at that time. Also, because they have left campus, we're their insurance. Some of them may not be able to meet with medical providers back at home. And so the counselors are also the link to the medical side. If our students are in need of medication refills and things like that, we are linking them with our medical providers to ensure that continuity of care.
Thank you for that feedback. Dr. Ross, do you mind jumping in and kind of telling us a little bit about, I guess, some of the mental health challenges that you all are facing at North Carolina Central?
Yeah, ours are very similar to what Slay said just a minute ago. The only thing I probably would add is grief. We're dealing with a lot of students that either have had contact with someone who has passed away and not being able to really to honor those people the way they want to, and then grief of the loss of their freshman year or the loss of their senior year. So a lot of grief issues have been paramount. You know, we were just in a unique situation. We just got 3 new therapists, which was like an act of God, that started literally February 2nd, 17th, and March 2nd. So we were in a really good situation where we have the folks to actually facilitate and help these students out. And all of them are full right now. Like, you know, we're in a situation where we have one therapist who rotates as the quote unquote walk-in therapist, even though it's virtually. And even that walk-in therapist is full on most days. So, you know, we're doing the best we can. You know, we have eight therapists, which I'm just so excited about. And they're all full right now.
Thank you for that. We are going to stay on topic, but we're having so many great questions coming in. We did want to allow our panelists to answer those. I think
so one of the questions that was just recently asked is, are we conducting COVID-19 testing?
Bowie State is not conducting COVID testing right now.
Norfolk State is not conducting testing on campus, but you know, testing is available in the community.
At North Carolina A&T, we have the ability, we have limited testing. We are being very selective with who we test just because our supplies are limited, but we do have the ability to be able to test.
And Alabama A&M is not doing testing right now. However, we are offering prescriptions for people to go get tested, because we have to have doctors' prescriptions for them to get tested at the testing sites. And so if we have students that are experiencing symptoms, we are prescribing that for them.
We aren't currently testing either. We have the capabilities to do so, but in the last day or so in what's moved in our system, we will have to begin testing here soon.
Thank you for that. Was there any other questions, Dr. Nicholson, you wanted to raise right now?
Yes, one of the questions that was just posted is to elaborate a little bit more about telehealth and how we're addressing the needs of the students that are out of state.
I'll speak to that just briefly. From a mental health standpoint, um, our student health plan, Blue Cross Blue Shield, offers Wobot, which is basically an app that students can use to talk to, I guess, kind of like a therapy session through their cell phone. So that is something that we're using. Our counseling services is still offering telehealth as well, or counseling through that means. So we're still able to provide some of those psychiatric and mental health services.
Anybody else want to add anything in regards to the telehealth option for students out of state?
Yes, it goes back to it just depends on what states they're in, but most licensing boards have you know, killed their restrictions on telehealth across state lines because of the situation. Hopefully our students will be back soon, but we're not sure. But we are working to also link them up with resources in their own community. There is, you know, there are different organizations like NAMI, National Alliance for Mental Illness, Thrive in Campus. And so there are different organizations that help us to identify resources in that student state to, you know, to use as a support. But also, if for some reason that student decides not to come back, then we'll already have that resource available for them in their state.
Thank you. I think there was another question.
Yes, the next question is, I know that we all are experiencing a shortage of PPE right now. And so one of the attendees has asked if there's a specific site that you are able to get PPEs from, because, you know, as we know, we're experiencing this shortage.
We do have a medical rep that actually sources the PPE supplies, and they're available. We just placed an order on yesterday, and it shipped Thursday. We shipped our mask, and on Friday we get our other supplies. So if anybody wants that, I can send you her name and number for that information.
Are you going to take like a 10% like referral
I wish.
fee,
I wish I was smart enough to do that.
I was just wondering.
Nah, I want to keep my job. I'm good.
All right. But yeah, we will provide, and if all our panelists are okay with this, we will provide contact information. So any of our attendees that want to connect or have questions, like what Dr. Ross just mentioned, if you need supplies or PPE, or if you just want to follow up to get more information about what these campuses are doing, we'll definitely share some information, their contact information, after this is over. We do have several questions coming in. I did want to give Dr. Burwell an opportunity just to talk a little bit more about mental health and some of those impacts, and then we'll answer some of those questions about counseling.
Okay, at Norfolk State, we've been dealing with some of the same mental health issues as some of the other campuses have been dealing with. But one of our things too is the fact that we've been dealing with students who have financial concerns. You know, with the campuses being closed, some of those students were working on campus. So that means they don't have the funds anymore from those jobs. And so that has been a task for them to try to find jobs back at home. Some of them have parents who both lost their jobs, and then they themselves are trying to contribute to the household. And then the mere fact that all of this has really been putting stress on them, added stress. And from the faculty standpoint, we have seen students, like somebody said, they've checked out. You know, they are not engaging in their classes, although this week we are actually in finals. But some of those students have actually not been engaging in those remote classes. So the university did put in a system whereby students could choose which option they wanted to use for their grade, whether it's a pass-fail or they want a traditional letter grade. So our counseling center has also presented through Instagram some sessions to help students de-stress. We've had sessions for students to, you know, get prepared for examination week. So we've, you know, put some things in place so that students have access to information that can help them. And we, as a faculty, you know, actually advertise those things to the students so that they know that they are being offered, as well as the information is coming out through our marketing department.
Thank you. And I think we have one or two more questions that were still related to that topic that just came in. Dr. Nicholson, did you have were there any other questions?
Well, one of the next questions is, that we do have, will counseling continue past the last day of examinations?
So at Alabama A&M, we have discussed the possibility of, you know, still supporting our students through the summer, since this is supposed to be going on through the summer, because we do not want to neglect any of our students. But we also are making sure that we are trying to link them up with resources in their respective towns, and hopefully they won't need us after examination.
Thank you. Did anybody else want to add anything to that as far as counseling after the last day of classes? Okay, great. Was there another question that you wanted to ask, Dr. Nicholson?
Yes. Another question is, what challenges will we be facing with students returning to campus?
Dr. Wutoh, you look like you want to say something about that. Your face lit up. You must not want them to come back, huh?
No, I really am waiting for them to come back. Our campus looks like a ghost town right now. We really are anxiously awaiting the students, but we have to do it in a phased and a very deliberate approach. So this week we started preparing. We're changing our focus for our emergency response team to now fall preparation. I think that's kind of going on across the country now, starting to look at what will be necessary for the fall. So the first thing is the availability of testing in our area that'll be more accessible. Right now it is still difficult. It still might take at least a week for students to get testing. There's only one free site right now that, available at our FedEx Field, and then through PG Health Department. And then testing sometimes can take anywhere from 2 days to 14 days for the results to come back. So that's still a challenge right now that we're facing. But aside from the testing issue is, again, getting the PPE, which just in the past day or so, one of my staff members is in contact with our distributor medical supply, and it looks like we will be getting some PPE within the next few weeks. So hopefully that comes to a reality, and then we'll be able to hopefully do testing on site, because I think students have already written in that they would like us to be able to provide the COVID-19 testing in our clinic for the fall. And I did talk to our Prince George's Health Department, our infectious disease section, and they've said that they'll work with us on on providing us test kits, viral cultures, etc. Also had spoken to them about maybe getting some more guidance as far as contact tracing as well. So I guess that's really, but we still haven't, we had our initial meeting on Tuesday. We talked about housing, because that's going to be a big piece. What are we going to do for housing? Are we going to have one student per room? Even we still have traditional halls that have one bathroom for like a hall of 20. So if one person comes down positive with COVID-19, all the people in the hall are potentially exposed. We don't really have a good place to quarantine people. And we're now talking about, will we reserve one small little building that has like maybe 8 units in it, aside for people who are exposed or potentially COVID positive. So that really, we have to hash out between our administration and Residence Life to reserve a building or some rooms set aside for students in the fall. We are also looking at spacing in the work environment, whether it's in budget office with cubicles, you know, what are the space constraints that we really need to look at? Some schools are using their architects or facilities to look at the spacing and see, do you move the seating arrangement within working offices, as well as in the classroom? Are you going to maybe have a hybrid of having some people in class face-to-face with masks on, and then the rest of the class viewing remotely? So those are the things that we're now starting to discuss. Haven't come up with, finite answers yet, but those are the types of discussions we're having now, is maybe a hybrid, and then also slowly phasing in the staff and faculty over the summer before the students come in. So maybe 25% of staff come on maybe in June or July or so.
At North Carolina A&T, we recently learned that we'll be resuming normal operations in the fall. So there has been a lot of discussion regarding how do we house the students.
So that decision's already been made? Like, I've already determined is that the same as North Carolina Central too?
Yeah, so the UNC systems.
Okay.
Yeah. So that should affect North Carolina Central as well. Right now, so we have housing issues already. We've admitted about 2,500 students. We have about 5,400 spaces, and that's based off of dual occupancy. But in trying to social distance and having roughly 3,400 returning students that are expecting to have a place on campus, I see that being a huge issue for us. So, I'm not sure how we'll work that out, but, there's a committee of people that have come together so that we can try to work out some of those issues and try to house some of those students. Another concern that I have personally are students that may have comorbidities. How do we make sure that we keep them safe? How do we make sure that the professors that may have comorbidities as well, how do we keep those people safe? And so I think that there's going to be a lot of discussion being had and needs to be had so that we can make sure that we move forward safely.
I think there were a couple more questions that were coming in and these are some great questions, by the way. Thank you all for this again. Dr. Nicholson.
Yes, one of the questions is, can we elaborate a little bit more on, is it realistic for us to practice social distancing on a college campus?
So these are 60 of my closest friends, right? I can tell y'all the truth.
Yeah, tell us true, yeah.
Yeah, no. I mean, no. I don't get to make those decisions whether students are coming back, but they are coming back, like Dr. Webb said, in our system anyway. And maintaining social distance is going to be virtually impossible. So, on our campus, what I'm preaching is we have to have the space to take care of 6 students, because that's what we're going to get. We're going to have 6 students. So all of my push and planning is around how do we take care of those students and try not to have the spread to faculty, staff, and the other students.
Anybody else? What are your, and this is just, I guess, opinions, thoughts, perspectives? Is social distancing, like, is that a reality? Like, what about in Alabama at A&M on your campus? What do you think?
I think, and this is my opinion, and I do not make those decisions again, but we know at some point the students are coming back. And I mean, it's a college campus and children are going to be children. Emerging adults are going to be emerging adults. They're going to test those boundaries. So it is probably going to be almost impossible to really practice social distancing, especially in our residential halls, our cafeterias. The classrooms. Like I said, students, they want to socialize. So if you put them together, they're going to get together.
This is Dr. Burwell from Norfolk State. I would say too that we as HBCUs, some of those decisions about students coming back is going to be out of our hands. But because this disease has disproportionately affected more African Americans and Latino population, we've got to be really careful about how we actually deal with this. Our students, our staff, you know, as a people, we're already stressed, and that in and of itself poses a problem with our immune systems. And then having, you know, other diseases, it's going to really pose a big problem, and how we deal with social distancing and some of the other issues that come with that. But I think it's particularly an issue with us as HBCUs.
Yeah, that's a great point, and that actually brings us to because we're getting close to that 1 o'clock hour, so we do want to respect the time. But that definitely brings us to our next point, that we did just want to briefly have a conversation about health disparities and the impact that COVID-19 does have disproportionately on communities of color, especially African Americans. And Dr. Burwell, you hit that right on the head. It's no secret that HBCUs serve majority African American students who come from all types of backgrounds, but they're coming from these communities that are disproportionately impacted. So I guess I just want to get some feedback or perspective from our panelists on, I guess, what are your thoughts on this health disparity? What are some things that you as a health professional can do, or what can our HBCUs do to improve this disparity or change this inequity that's happening in our community? So I guess just some feedback or open conversation about just your thoughts on how this pandemic is impacting our communities. Dr. Burwell, did you want to kind of elaborate a little bit more? And then I guess whoever else wanted to come in can feel free to jump in on that conversation.
I, you know, just want to say that one thing that has actually come out of this whole thing is the fact that it has put the focus on health disparities. You know, there are some people out there that don't think that health disparities even exist, but we know that they do. And, you know, we're the folks who have to still go to work, you know, in those essential positions, have to have, you know, close proximity with people, folks who are working, you know, in those meat plants. We've seen the situation, and, you know, our folks have the high blood pressure, the diabetes, the asthma, you know, disproportionately. And this has really put a focus on health disparities. And I think our campus is really going to have to emphasize more education, you know, just giving more information out about how not only this disease affects us, but other diseases as well. And I would also say that I would challenge folks at the PWIs, the other institutions who have a good population of African American and Latino students, that they are going to have to actually step up to the plate to provide that education as well.
Thank you for that. Did anybody else want to add anything on health disparities and communities of color, and just your thoughts or perspectives on that? Okay, we are getting close to that time, but we had several questions come in, so we do want to have an opportunity. If you haven't asked a question, or some of those questions that we didn't get a chance to get to, we do want to take these last few minutes to just answer some of those questions. So Dr. Nicholson, feel free to share those questions, and anybody on the panel who wants to chime in or add any feedback on that, please feel free.
One of the questions that I just received was was on antibody testing. So one of the concerns that we've all noticed was that several of the facilities that were providing antibody testing results are not accurate. And so I wanted us to be mindful of that before we decide to jump on in and ask all the students for antibody testing, that we keep in mind that some of the facilities that are providing that services have not been reputable, nor have the results been accurate. But the question was posed, how do we want to handle the students coming back? And is antibody testing one of the options we are considering?
You know, for us, we are considering antibody testing, but for the same reasons that Dr. Nicholson just said, you know, we're leery of that. You know, what I'm pushing is for policies around flu vaccines? Like, can we make that mandatory to take care of that part of it so we can at least rule some of those things out? And these immunizations, you know, just, we don't even have requirements around those right now. You know, some of the ones that we probably should. So I don't know that we're going to do antibody testing, but we're definitely pushing for some of the other things that we already deal with.
Yeah, I just wanted to share that at Bowie State and in conversations with our University of Maryland systems partners. At first, I was thinking about the antibody testing playing a role, but less likely as I talked to my colleagues at University of Maryland. The question is really, we don't know what it really means. Even if you did have antibodies, we don't know whether it's protective or not. And it actually may just be a very small segment of the population. We're still going to have a number of people who are vulnerable coming back to campus. So, so that's looking less likely that we'll make that a requirement.
And one point to bring up, even if we did antibody testing, like what do we do with those results? You know, like how really do you handle that? So that's something to kind of ponder on and think about.
Definitely. Like I said, I think there were a couple more questions that came in, so we do want to try to get to some more of those.
Mm-hmm. Yes, the next question is, how do we plan on educating our students on the importance of social distancing?
Well, we have a marketing director inside of Student Affairs. So she's been pushing things already. We've had a little bit of practice because like I said, we had students that were actually positive for this disease on our campus. And, you know, reiterating, stop touching each other, stop being around each other, just, you know, practice the social distancing has been challenging. So we're just pushing stuff out almost every day to our students on our platforms, you know, helping them understand in all kinds of ways, videos, you know, infographics, emails, texts, every way we can. And I don't think we're going to stop doing that for quite some time.
Yeah, I would say as a faculty member, we've been sharing videos that we can put on our platforms to let students know the importance of social distancing and what it actually will do to help flatten the curve with this disease.
Are there any more questions? I'm sorry, go ahead.
I'll just make a comment in regards to that, the social distancing. That is going to be a real big challenge. We certainly already have signage on campus. We need to actually, that kind of reminds me, I need to put more on social media about social distancing. But when they come back, we do need to also talk to them, or even before they come back this summer, really encourage people not to put themselves at risk. And that's going to be a hard balance. I mean, I have an 18-year-old and she wants to go, she already had applied for a job this week and she wanted to go out and work at a pizza shop, you know, and it was like, my husband talked, you know, she had an interview for today. And my husband's like, you know, no, you don't need to go out. You know, as African-Americans, we are 80% of hospitalizations. We're the highest risk group that's dying out there. Why are you going to go get a job at a pizza, you know, at a pizza parlor right now, you know, when we're in a state lockdown, you know? So I think we have to talk to them, just like as my 18-year-old daughter, but talk to the other students. You know, a lot of them are working right now, even 2 jobs at a time right now while they're trying to finish up the semester. I had a young man who was working in a group home. You know, a lot of our students are, you know, nursing or nurses' aides. And so they're putting themselves at risk right now, going into areas, and they're not even being properly protected by their employers. So we need to put out more messaging about, you know, is it really, it's not worth that $100. You know, maybe you might need a student affairs loan, or let's see what we can do to help you get through. But as you're putting that, that risk, think about, they're not thinking about it. They want to get out. They want to, you know, they feel like they want to like meet people and stuff like that. So that's where they're thinking, and also thinking about money. But that $100 or $200, they're putting their life at risk because, you know, just in one day, they could be exposed to somebody with COVID-19 and be infected. And that could mean their life, even as a young person. So I think we got to put out more information or education, really telling them to hold back, you know, and even sacrifice at this time.
Thank Thank you for that. So we have reached the 1 o'clock hour on the East Coast. We did schedule this for 1 hour, so we do want to respect your time. But thank you all so much to all of our panelists, all of the HBCUs that were represented today, as well as our attendees that joined us. Thank you for this wonderful dialogue and this conversation. For those that pre-registered, we will make a recording of this session available and we will send that to you, as well as a follow-up. There'll be a short survey for you to complete because we will look at having these Q&A webinars again on different topics. So please, if you pre-registered, look out to your email for other opportunities to join us, as well as any questions that weren't raised today, or if you want to engage with our panelists again, we will make their contact information available. But thank you all again for joining us for our webinar on HBCUs in the age of COVID-19, and we hope you all have an amazing day, and please stay well. Thank you.
Thank you.
Yes, thank you.
Thank you.
Thank you.
Thank you.